Yes, I'm Councillor Cyndi Hughes, Lead Member for Children and Young People. The proposal is to actually increase the budget area of children's services during this budget round, and that's to reflect the fact that we have more looked after children, and also we needed to reinforce some of the support that's offered by social workers, lowering their caseloads and those sorts of things. So I'm thankful that my cabinet colleagues understand that we have not only a statutory obligation to do this work, but a moral obligation as well. In regard to one of the proposals to deal with early help for the 0 to 3 diagnosed disabilities for families with children very young children who've been diagnosed with a disability, that was a cut that we were looking to make, but we found that we won't be having to make that because families have made really heartfelt pleas to us that budget has helped them to deal with the early diagnosis and to put their family on track. And we feel that by doing that, it's a form of early help, and it can keep families from tipping into more specialist services. So there's a business case for that as well as a moral case. Well, there have been families that have come forward to say how magnificent children's centres and the work that they do and that they've provided to their families over the years, and I agree with that, and my cabinet colleagues agree with that, but unfortunately because of the budget cuts that are being dished as it is, so we're looking to phase in some changes, and again it's part of our early help redesign, and we're looking to save as much as that as we can, but really it's going to be about targeting those families that are the most vulnerable. So, the fact that some families like to go and they like to take part in activities at children's centres, it's wonderful, but our focus is really going to have to be on those families that need those services most. Well, I think that across the board we're going to be having less contact, universal contact with families and children. And thankfully, most families in Darlington are strong and they won't necessarily see a change. But for those families that have difficulties, and some of them are beyond our control, things like child poverty, mental health issues of parents, and also drug and alcohol situations, problems with parents, they're not really within the control of the council. So we're going to have to work ever more closely with our partners, health, with the police, with all of our partners, to try to deal with the issues before they become so severe that children's services needs to become involved.